As the South African Department of Health confirms over 1,000 positive cases of COVID-19, the country's ability to manage the virus becomes a growing concern. While limited resources and a dysfunctional public healthcare system, medical staff have their work cut out for them. Chairperson of the Rural Doctors Association, Dr. Lungi Hobe, joins us now via Skype to give us the association's assessment of the coronavirus situation on the ground. Dr. Hobe, before we speak about the matter at hand, what is an association for rural doctors? What kind of issues does it deal with?
Good morning to everyone. I am Dr. Lungi Hobe, currently working in a rural hospital in KwaZulu-Natal. So the RUDASA, as we affectionately call it, is the Rural Doctors Association of South Africa. It basically is a community where rural doctors get to interact on rural issues, provide support and networking. At the moment, our major goal is providing rural mentorship for healthcare workers working in rural. So RUDASA was sort of the founding body, and then we have since birthed RURISA, which caters for rehab, and then RUNESA, which caters for nurses, and PACASA, which caters for clinical association or clinical associates in South Africa. So each year we meet up for a rural health conference at different sites to just discuss issues that are pertinent to rural health.
The COVID-19 outbreak has called for a reprioritization for most associations. What issues have presented for you particularly in terms of this outbreak?
So being in rural health, we all know that with our statistics, rural population basically accounts for about 42% of healthcare services. With that 42% of the population, we only have 15% of the doctors looking after rural care, and then 20% of nurses. And this causes a major concern for us in terms of human resources, which has always been a major issue. But now with the COVID-19, it's going to be a particularly major issue. But on top of the human resources, we're looking at just general resources on the ground. So most rural hospitals have high care or high care units, but they do not have ICUs. And we know that with regional hospitals being the referral units for COVID, we may swiftly run out of beds to refer cases. So we are concerned about the level of ventilators or ventilated beds available to rural communities. And then on top of that, it's issues with EMR or emergency medical services as well. We are constantly struggling with that outside of the COVID outbreak. So now that with the COVID, it's just one of the issues that we as RUDASA are concerned with.
You touched on a few points there, and I'll try to speak to some of them. But you were talking about the unavailability of ventilators, and it's a global conversation right now. Is there any conversation amongst doctors, amongst healthcare products producers, about the production of ventilators? Of course, the big issue here is that it should be ventilators that meet a certain standard. Why can't we produce these for ourselves?
Well, I don't think that I'm in a position to be answering that, but I will tell you this. Within our organization, there is a video that is being shared about you possibly using one ventilator to ventilate 4 cases. So we are sharing this video far and wide and just calling for people who are engineers locally to maybe look at it and see if it's potentially something that we can be looking at during this COVID outbreak. And maybe if it works, it can be something that we look at, possibly providing in the long term for the rural communities. But in terms of why are we not manufacturing our own ventilators, I'm not sure that I can answer that question. I think it should be a question that will be posed more to the medical supply companies in South Africa. And as Rudasa, we're very much available and happy to, then avail ourselves to be in some of the advisory committees as leaders unite against this fight.
You also lamented the fact that most rural hospitals, some will have a high care facility but not ICU. How much is Rudasa interacting with government in terms of the specially designated areas for positive cases?
So we do have a member of our executive committee that sits in the ministerial advisory committee, which we have uploaded and we have welcomed and appreciated. And through him, we are send suggestions from the executive committee and Rudasa committee through to ministers, through to the Minister of Health. We are greatly concerned about the resources, and it has one of the things that we have saying we need to be out there. We need more rural hospitals to be telling us what are some of the things they are struggling with. We would request for rural hospitals to get in touch with us, look at their particular needs, monitor their levels, and sort of trajectory, what is it exactly that they anticipate in terms of patient numbers, in terms of the facilities that they may need going into the future, and then just alerting us of these things so that we can communicate it through our candidate.
Of course, the other limitation is testing material. But in terms of the rural picture, what trends are you picking up in terms of COVID-19?
So in terms of the rural communities, there is definitely not a lot of reported cases as yet, but we are very concerned with the lockdown that happened 2 days ago. Everyone basically just decided from their areas of employment, which is often in the urban areas, that they were going to commute back into the rural areas. So we are very concerned that there's a large number of the urban population that has now moved into the rural areas. And because of this, we are worried that within the next week or two, we may start to see a surge of COVID-19 cases coming through to our facilities. And this is a major concern for us in our rural facilities.
Is Rudasa part of the efforts to track down and trace people who might be bringing COVID-19 into the rural areas from the cities?
So Rudasa hasn't really been involved with the communities, but we are involved with the personnel in the hospitals and advising them and making sure that we're putting out factual information out to the communities just send a solidified information out there. So our other major concern with rural hospitals is that with the lockdown, people in rural hospitals or rural communities rather do not seem to be taking the COVID-19 serious. All regulations have been put in place to an extent that rural communities are actually continuing to have large functions, have parties, weddings, and large funerals. People within rural communities are actually moving around quite freely because, as you know, rural population is quite vast. So it is very difficult for every an SABC to actually cover all of these communities. So we are calling out to the community to really adhere to regulations.
It might not be a very clear line, but I think we got the gist of what Dr. Lungi Hobe was saying there. Thank you so much for speaking to us this morning. We hope to stay in touch with you for the next 21 days because you present a very, or you represent as well, a very important aspect of community in terms of tracking down the movements of this virus in the country. Dr. Lungi Hobe is the chairperson of the Rural Doctors Association and talking to us there about the challenges faced by rural doctors in terms of the COVID-19 outbreak.